Thanks everybody for joining us today for I can't remember, our third or fourth Lunch and Learn to present the work of one of our summer scholars. So Ethan Rogers is a postdoc fellow here at the Public Policy Center in our Crime and Justice program. So he worked with, I will mess up your name, Andrew Krajewski at the University of Texas on a project linking mental health and violent behavior, which I will not try to continue speaking about because I don't know, but I'm interested in hearing. So thank you again for presenting today and for being summer scholars with us this year.
Thank you.
Take it away.
Thank you. Let me share my screen here. All right. If anyone can't see that, let me know. Thank you to everyone for being here today. We really appreciate the turnout. Got a good group here, so feel free if at any point during our presentation you want to interject, ask a question, please jump in and do so. I also want to extend a thank you to Pete and Juliana and the Public Policy Center for this opportunity to work on this project through the Summer Scholars in Residence program. Just to comment briefly about its value, we did really appreciate the chance to just kind of throw our heads into a specific project. Andrew and I met pretty frequently. We also really valued being able to bounce our ideas off folks here at the center, namely Dr. Berg. Marcus, either here. Thank you for your feedback as we worked on this. And also one kind of unexpected, but also probably obvious to many of you in terms of value of this project is it really did allow us to kind of set up the foundation for additional projects. Just as a quick aside, Betsy Momini, a thank you goes to her as she knew we were working on this project and just recently in the last, I believe it was about a month and a half ago, she forwarded along a call for submissions for a special issue on a project specifically on mental health and physical health of incarcerated transgender individuals. But because we already had kind of the data in place, we also have a colleague, Steph Schuster, who works in transgender healthcare. It kind of set up this kind of fortuitous option, or I guess opportunity for us to pursue another project. So we would not have been able to do that had we not had this time to kind of devote to this data set. So a big thank you towards that. So today we want to talk about this project currently titled Mental Health and Gun Violence. Is there a link? And in the core focus of today's talk is to kind of set up the background of the study, show you some of our results, largely descriptive results, but then hopefully open the door to any questions or comments you may have about maybe additional analyses that we should consider or supplemental analyses that we might want to consider. Also helping us kind of work through the implications of some of our findings. So we look forward to your feedback. What we thought we would do to kind of kick off the presentation is really to root the project in our broader understanding of gun violence in the United States. So I'm just going to give you the intro to gun violence, highlighting some kind of key facts that also inform this study. So first off, we know in the US, our gun homicide rates are far higher than our non-gun homicide rates. Exemplified here by this figure coming from a project, a book chapter I recently worked on with Dr. Berg, highlighting the firearm homicide rate and the non-firearm homicide rate from 1990 to 2019. Again, as you can see, that gun homicide rate is considerably higher. But another way to say this is simply that from about 1990 to 2015, the share of our homicides in the US that involved guns fluctuated between 60 to 70%. So again, the majority of our homicides in the US do tend to involve guns. But another important piece about gun violence is that many of our recent increases in violence, particularly homicide, has been driven by increases in gun homicide. So here, if you take a look, this is the trends in firearm and non-firearm homicide rates, but I've adjusted the non-firearm homicide rate by a factor, I think multiplied by 1.68 to get the level equivalent to that firearm homicide rate so that we can look at how it changes over time and if they parallel each other in terms of their trend or diverge in any way. And what you see here is despite that initial bump in the early 90s, overall firearm and non-firearm homicide rates did decline through the 90s in a very similar fashion. However, since the early 2000s, we've started to see somewhat of a diverging trend. Again, if you look at non-firearm homicide rate, it's either stabilized or it's gone down slightly over time. Where when looking at firearm homicide rates, we do see some moments of increase, right? In the late 2000s, but most notably in 2014 through 2016, we saw a spike in homicide. And again, it was largely driven by gun homicide. So what's the consequence? Well, in the US now, for the last 5 years or so, the gun share of homicides has been pretty consistent at 70%. Rather than that fluctuation, every year we've seen, again, about 70% of our homicides involving guns. Now, that's also demonstrated for those of you who may have been following the recent spike in homicide in 2020. We saw a similar pattern. So in 2020, the gun share of homicides is now, best estimates suggest, around 77%. So as time has gone on, our share of homicides are more and more represented by gun homicides. But that comparison isn't only true over time. We also see it across country. So what we see here is from one study by, I'm not going to be able to pronounce the first author's name, but in this study, they compared our homicide rates in the United States with other high-income OECD countries. And what they found was that the US homicide rate was approximately 7 times higher than these comparable countries. But when you break it out by gun versus non-gun, you see some pretty stark differences. One, that the US non-gun homicide is 2.7 times higher than other countries, while the US gun homicide rate is approximately 25 times higher. And this has been replicated also with 2015 data by the same authors. So again, I want to highlight that these findings, both over time and across countries, are emphasizing one very important thing. And that is gun homicide is not simply homicide by another name, right? Gun homicide does show some unique pattern and some unique trends that we need to take into consideration, particularly for the US. A couple other key points about gun violence is naturally, gun violence is beyond simply gun homicides, beyond lethal gun violence. We know that there are far more non-fatal gunshot injuries, and even beyond that, many assaults and robberies that involve guns. And the costs of gun violence are, while very difficult to calculate, it's very clear that they are extensive, right? So when looking at economic costs, our very own Corey Piquesa and colleagues put together an assessment of annual hospital costs for firearm injuries at approximately $622 million. Of course, those firearm injuries did include more than simply gun assaults, but that was the majority. Also, there is evidence about community shootings and their association with property values and business outcomes. And we know that firearm violence is a social determinant of mental health as well as child development. So gun violence is clearly a matter of a public health challenge, right? In terms of both of its extent in the United States, but also its costs, right? And so you would think, in general, the policy discussions would be rather broad as well. But one thing that many experts are starting to highlight is that it tends to be one specific form of gun violence that tends to drive our public discourse and our policy decisions in terms of how to respond to the gun violence crisis. And that tends to be mass public shootings. Now, of course, we know, based on the data, that our mass public shootings are a very rare form of firearm homicide. represents only a fraction, but we also know that the public impact is considerable. So just as one survey example from the American Psychological Association in 2019, roughly 8 in 10 adults reported experiencing stress as a result of the possibility of a mass shooting, and a third said that fear of mass shootings prevented them from going to certain places or events. So certainly, even though it represents only a fraction of homicides, it has, again, a considerable public impact. And now more recently, research also indicates that public discourse also leads into policy change. So a recent study by Luca and colleagues in the Journal of Public Economics find that mass shootings are associated with I think they identified a 15% increase in firearm legislation. And notably, while they said that their estimates are just that, very rough estimates, generally a mass shooting was the equivalent of about 125 other homicides in terms of impact on firearm legislation. So again, mass shootings not only just driving public discourse and public concern, but also seems to have an impact on policy change. Now, where's the rub here? And that is, if you take their analyses one step further, you find that change was only in Republican legislatures, and the bills being presented tended to be an increase in bills that loosened gun restrictions. Now, if that is what we're generally finding, this link between mass public shootings and a loosening of gun restrictions, of course, we need to talk about, well, what are the policy responses? And the dominant policy response, particularly recently, has been to fix mental health care. I'm sure many of you have heard the narrative, but essentially, if you fix the mental health care system, the idea is that you would fix the gun violence crisis. And I want to talk a little bit about that mental health narrative, though, again, I'm sure many of you are familiar. So this can be, in part, not so explicit or, a little bit more subtle, but just noting that many individuals, when talking about mass shootings, kind of fall into this tautological explanation of mass shootings, right? As exemplified by President Obama, saying that anybody who does this has a sickness in their mind, right? And it creates somewhat of a circular process, right? A terrible thing happened. Why? Well, somebody must have had a mental illness. Well, how do you know they have a mental illness? They did a terrible thing, right? And so it starts to go in this cycle. But more explicit, you see narratives of other politicians. For example, President Trump noting mental illness pulls the trigger, and then our senators here in Iowa following a similar narrative. Senator Ernst explicitly kind of juxtaposing the Second Amendment against addressing mental illness. But beyond politicians, of course, media drive this mental health narrative. We know that mass shootings are associated with an increase in media coverage on gun-related violence. But within that coverage, we tend to see a heavy focus on diagnosing the shooter. Also, that we see generally coverage on mental illness disproportionately focuses on violence. So McGinty and others provided one study identifying, I believe it was about 38% of all coverage on mental illness focused on violence. Of course, that's disproportionate to the share of violence contributed by individuals with mental illness. And I would be remiss not to just note that there's also some research highlighting the racial variability in coverage, that it tends to be white men who get the attribution of mental illness, while Black men are more often framed as perpetually a violent threat. So there are some racial differences across coverage, but the mental health narrative still emerges. And it is a narrative that the public seems to purchase. In general, individuals favor solutions that focus on mental illness. So in 2013, about 6 in 10 favored increasing government spending to improve mental health screening and treatment as a strategy to prevent gun violence. Then in the same survey, 85% favored requiring states to report a person to the background check system who is prohibited because of mental illness. And then more recently, a similar finding, 89% favoring preventing people with mental illnesses from purchasing guns. So this whole narrative does then lead into policy. Just for example, there's been calls for national registries for people with mental illness. Also, during the Obama era, there was a rule proposed to enter Americans who receive Social Security benefits for mental illness into background check systems. I won't get into too many of the details here, but just as an aside story, as a point of interest, after President Trump came into office, Congress blocked that rule, and kind of a rare turn of events, the ACLU came out in vocal support of President Trump and Congress for blocking this rule. And largely their argument was that this type of rule was unfair and ineffective, but also relying on some stereotypes about individuals with mental illness. Mental health experts have also kind of raised concern about these types of policies, fanning stigma about mental illness, and also underline the possibility that it may deter individuals who need treatment from seeking that treatment, given that it may remove various rights, including access to firearms. So we need to take a big step back here and consider where the evidence stands on mental health and gun violence. Now, of course, the challenge here, especially when you start talking about mass shootings, which I won't dive into too much, is given how rare of an occurrence it is, it's very hard for the research to get any good kind of claim about that link. So most scholars that study mental health and mass public shootings, most of them take a step back and say, well, let's look at the broader literature about the link between mental health and violence, and assuming that we can kind of make some conclusions from that research, we'll go from there. And what the evidence tends to suggest is that there is a modest association between mental health and violence. The research tends to highlight that, and I'm very cautious in the language because caveats abound, right? In general, you can kind of see why there's a lot of clarifications that need to be made about this association. For one, when we say mental health is moderately associated with violence, what do we mean by mental health? Generally, the research is looking at serious mental illness when studying this kind of link, but of course, mental health can be defined much more broadly than that, whether by type, severity, and acuity. We also have some concerns about the ever stated correlation does not equal causation. There has been research that suggests that link may be spurious to other risk factors, and so we need to always be cognizant of that consideration. And then that number 3 I want to highlight is the simple fact that only a fraction of violence, even if mental health is associated with violence, only a fraction of violence is attributable to mental illness alone. Swanson and colleagues have recently estimated that if you entirely eliminated the elevated risk of violence by mental health, you would be removing maybe about 4% of violent incidents, right? So again, a big chunk of violence is being committed by individuals without any indicator of mental illness. And then number 4 and number 5, I'm sure many of you have heard, of course, majority of individuals with mental illness are not violent, and they're also more likely to be the targets of violence rather than the perpetrators. But the next question that comes up is, what about mental health and gun violence? And the distinction here that while I'm almost essentially said the exact same sentence, the emphasis is on gun rather than violence. So here we want to think about our questions about if participating in violence is a gun involved. And here the research is far less numerous or extensive, but there are 2 studies that start to look at this. So Lewin Temple, with a sample of about 600 young adults in Texas, found that mental health was not associated with gun carrying, and they also found that it was not associated with making threats with guns. Okay, so some suggestive evidence that perhaps the link between mental health and the use of a gun may not be quite as strong. Also looking at a study by Swanson and colleagues using some Florida data, comparing a study population of individuals with mental health diagnoses compared to the general population, what they found is the violent crime arrest rate among the study population was nearly double that of the general population. But when looking at gun-involved violent crime arrest rates, those were nearly identical. So if you take that next step, then essentially about 13% of violent crime arrests among the study population involved guns compared to 24% of the general population. So some research indicating that yes, while there may be a link between mental health and violence, perhaps the link between mental health and specifically gun versus non-gun violence is less strong. But we wanted to take it a step further using a different data set to kind of further explore the mental health burden of individuals who participate in gun versus non-gun violence. And that's essentially what we'll do. Andrew is going to talk a little bit about the data and the methods and the measures going forth, but we're really looking at now I want to emphasize, it's not a comparison necessarily about violence versus non-violence. Here, we're really trying to take it to that next step to looking at gun violence versus non-gun violence. And then a challenge here is that we know with case fatality rates that gun violence tends to be more lethal. So we also do some supplemental pieces here, or I shouldn't call it even supplemental, it's primary, where we look at lethal gun violence versus lethal non-gun violence, and then also compare non-lethal gun violence to non-lethal non-gun violence. So at this point, I'm going to turn it over to Andrew, and he can talk a little bit more about the data and the measures.
All right, I'm going to just go ahead and share my screen. Okay. Can everyone see this right now? Okay, so I kind of want to echo everything Ethan said at the beginning. Thank you so much for having us. We're really excited to kind of talk about this. And so to address those two research questions, we're going to use kind of two related data sets: the 2004 survey of inmates in state and federal correctional facilities, and then the newest edition, the 2016 version that just came out several months ago on public access. And so these two data sets are collected by the Bureau of Justice Statistics in collaboration with the Census Bureau, and they're cross-sectional surveys of the state and federal prison populations, and they were designed to collect information on prisoner or incarcerated individuals' demographics, as well as their physical and mental health. And then, so in addition to kind of that stuff, this is actually a really unique data set because it collects pretty extensive information on the offenses that led to the incarcerated person's incarceration, right? So it has, victim characteristics as well as presence of a firearm. Now, one thing to keep in mind is that this is cross-sectional and it's a survey of the stock of incarcerated people. And so because of that, part of the challenge was kind of trying to find a strategy that lets us identify, or as closely identify mental health as it related to the offense and not mental health as it relates to the incarceration experience. And so one strategy that we use is we actually limit our sample to anyone who is incarcerated for under 2 years. And that's just trying to kind of focus on those people who are newly incarcerated to better identify maybe mental health before prison. And so just a little bit more information on the two data sets. They actually follow two very similar sampling designs that comprise of two stages. In the first stage, there was a random selection of prisons. And so the way the BJS did this is they stratified a list of prisons according to the sex of those being housed, the jurisdiction, so state or federal, as well as the size of the facilities. And they randomly selected them for participation. And then within the random selection of prisons, they actually did a random sample of those incarcerated people. And so what they did is they picked a random starting point and a random skip code, and then they went through the population. For state prisons, this is a simple random sample. So basically everyone had equal opportunity. And then for the federal samples, they actually stratified it by drug offenses due to the high number of drug offenders currently incarcerated in federal prisons. And so they did this in part because they wanted to make sure there were sufficient numbers of non-drug offenders and drug offenders for analysis. And then on top of all this, They really they created survey weights to adjust for non-response bias and coverage bias. And we use those survey weights in producing the descriptive statistics that we show today to try and get at a representative sample of those incarcerated for under 2 years. Okay, so that's the sample. So what kind of measures are we talking about? So as I said, this survey actually has very detailed information on the offenses that led to incarceration. One of the strategies that they do to do this is they classify people according to the most serious offense. Most serious oftentimes is violence because they define serious in terms of how long they were sentenced, the offense for which they were sentenced the longest. And so we use that offense type, so violent, property, drug, other public order offenses. And then we also use another variable that asks the respondents whether they possessed a firearm at the time of the offense. So did you carry, possess, or use a weapon when the offense occurred? And a supplemental question asks, was it a firearm? Yeah. And so we combine these two measures to create a categorical variable that talks about firearm violence, non-firearm violence, property offense, and other types of offenses. So in those other offense, we're looking at drug offenses as well as just other public order offenses. And then to answer kind of the second part of our research questions, we also separate then violence into lethal and non-lethal. And so this is just a way to kind of ascertain, is it about particular types of violence, and also kind of disentangle what Ethan was saying about how firearms are also just associated with fatalities. When we look at to measure mental health, the surveys take on a very different strategy. So I'm going to kind of describe them in turn. So in the 2004 survey, they use a simple dichotomous variable, which is basically, have you ever, and then they, during the last year, have you ever? And then they proceed to ask them a series of questions, right? Have you talked or moved more slowly? Have you given up hope for life or the future? Have you felt numb or empty inside? And they ask about 16 or so of these items. And the BJS actually provides some criteria to kind of separate these items as indicators of either major depressive disorder, mania, or psychotic disorders. And so we rely on their criteria for this presentation. And so if they meet the criteria, and it's like for major depression, it's like they have 3 of the associated symptoms, we mark them as kind of being consistent and meeting that threshold. I don't show the specific criteria in this presentation, but I do have an extra slide that I can go through and kind of walk through the coding strategy. So this is for symptoms. For the 2016 symptoms, they actually have frequency measures. So about how often during the past 30 days, as opposed to the past year, have you felt nervous, hopeless, restless, that everything was effortful, or that, you felt worthless. And so this one is actually more designed around a normal mental health scale, the Kessler-6 score. And so this is taken by taking the sum of the frequency measures. For those who have at least a score of 8 to 12, they're kind of seen as having some problem related to anxiety. Whereas if they have 13 or more, it's some indicator of serious psychological distress. And so we follow the scheme for the presentation where, we separate people according to anxiety or serious psychological distress. And then as a third measure of mental health, we're being very comprehensive with this. We also measure clinical contact. So have you ever received a clinical diagnosis for a mental health problem? Have you ever taken medication for a mental health problem, counseling, or ever hospitalized for a mental health problem? Now, one caveat here is the counseling variable is coded slightly different in the 2016 survey, where all the others are generally the same. And so we don't actually show the counseling variable here. All right, so let's kind of dig into the data, look into some descriptives of demographic characteristics. All right, so I separate these things on the left side by 2004 and on the right side by 2016. And so we can see just from these like basic demographic characteristics that a higher proportion of violent offenders who used a firearm were male relative to those who didn't use a firearm during a violent offense or just other offenders, so property, drug, things like that. So we're looking at like 96% compared to about 87%. Okay, and then we can kind of look to race. And so we still see a higher proportion of minorities commit violent offenses with a firearm. And this is seen both in the 2004 and 2016 data set. And then finally for age, to some extent, we see that a higher proportion of younger people commit violent offenses with a firearm. And this is actually one of the areas where we see some difference when it comes to age between 2004 and 2016, where we see 22% here compared to 13%. And so like in talking about this with Ethan, as we were looking at the results, this is quite consistent with this idea of kind of an aging of the prison admission or prison population. And so that's something important to keep in mind here, and it's kind of consistent with that general theme. Okay, so there's descriptives of demographics. Let's move into some mental health. Okay, so this is just, so on the y-axis here, I guess, we have different offense types. So people who are incarcerated for firearm violence, here, non-firearm violence, property offenses. And then we have whether they have experienced any symptoms or history of clinical contact in gray, and then yellow is they have no evidence of having mental health problems. And so what we see here, although it may seem that there are some categories that are a little bit more prominent, for example, firearm violence relative to non-firearm violence with 5%, the results aren't actually, they don't reach statistical significance, except for firearm violence compared to other offense. And so it's hard, although it's tempting to kind of overinterpret like a non-significant result, I really do urge caution in that regard. And so this is just an either or, right? You either have mental health issues or some evidence of, or you don't. We can also break it down based on if you only experience symptoms, this dark gray, if you have a history of clinical contact with the light gray, or both with the blue, right? And so I don't actually put the numbers here, but I just wanted it more as like an illustrative purpose of showing that, within these mental health experiences, there's actually a lot of kind of different experiences and different kind of exposures to mental health issues. Now, this was the 2004. And so we can also kind of go on to 2016, where we see similar results. Again, they're not statistically significant. And we can talk a little bit more about that in the kind of the Q&A, I guess, about how our kind of research decisions early on may have affected our statistical significance here. But even above and beyond the non-statistical significance, you actually see slightly smaller or more comparability between the offense categories. Yeah. And again, I think one thing I want to stress here too, actually, is that it's hard to like compare, let's say 2004 to 2016, in part because the measurement strategies for mental health are slightly different. I think you can look to the broader patterns of relationships, but it's really hard to say, oh, look, in 2016, 53% of offenders had mental health problems compared to whatever in 2004, just because of the different measurement strategies. All right, and then we can also, again, break it down. And this is something I also want to kind of bring attention to, which is this is partially related to a research design decision that Ethan and I made, which is mental health symptoms here is those coded as having serious psychological distress and not necessarily that anxiety related issue. And so this could grow more depending on what threshold you want to use this, being characterized as having like a problem, like a mental health issue. But again, there's not doesn't seem to be much evidence so far in terms of does offense type, especially with regards to firearm, discriminate mental health symptoms and mental health treatment. And then we can kind of get into this, but in general, we see a very similar pattern. So instead of doing it by firearm here, we actually break it down by firearm and lethality. We removed other offenses here. So we don't have property or other offenses. And this is mainly to focus on that second research question, which is, does it kind of matter about the qualitative characteristics of violence, right? So on the y-axis, we have all offense types at the top, kind of as a general benchmark. But then we separate it then into firearm homicides, non-firearm homicide, and then just general firearm violence or non-firearm violence. And so there's some slight evidence maybe of there being more mental health burden in that firearm homicide category, but it's not statistically significant. And even in terms of effect sizes or differences, it's just not great in magnitude. And so we're not seeing much evidence that offense type, regardless of if we look within different types of violent offenses or between firearm or non-firearm violence, that it really discriminates. Again, we can then break down into the different versions. And we still see quite a bit of comparability here. And then we can also then look to 2016, where again, we see similar patterns. The differences are maybe a little more prominent here between firearm homicide and non-firearm homicide, but it still doesn't really follow a specific pattern, and it doesn't reach thresholds for statistical significance. And I don't want to put too much emphasis on statistical significance in general, especially given our sample limitation in some ways. But even if you look at the magnitude of the differences, I don't know what substantive implications would 61% have as opposed to 59%. And that's something that Ethan and I have really wrestled with, which is, okay, we understand we're limiting our sample in several ways in terms of sample size maybe, but what are the meaningful interpretations of some of this and what does it mean? Okay. But again, this is even a kind of a somewhat crude measure in the sense that we're taking a summary score of if you've experienced any symptoms or history of clinical contact. We can also look at it individually, and I see that some of the words got cut off. So if we look at the 2004 mental health symptoms, and on the y-axis, it's that proportion, and on the x-axis, we now have different outcome measures. We can see, based on each point, which is different offense types, we can see that there's really not many meaningful differences, right? So the confidence intervals overlap quite considerably, but also even the point estimates are of comparable magnitude. So for example, major depressive disorder. So this is any incarcerated individual who reaches that BJS threshold for major depressive disorder. Firearm homicide, if you even want to interpret it, is actually lower than non-firearm homicide. Right. So it doesn't seem like there's that strong relationship there that we can, at least from this evidence, say that people who use firearms or not use firearms are dramatically different in their mental health. And again, kind of going to back to that point about statistical significance, when we compare other firearm violence to other non-firearm violence, we actually see a statistically significant difference. But it's not really convincing enough to suggest that it's not just noise, right? When you're running this many statistical tests, some are bound to come up just in the way of probabilities. Okay, and so we can see there's quite a bit of clustering. And so this is 2004 symptoms. A similar pattern emerges with 2016 symptoms. Right, so the combined total is if you were to just combine these two groups. But yeah. So again, these are 2016. So these are basically, do you have 13 or more on the Kessler-6 score or 8 to 12? And again, you still just don't see that much differentiation, I guess. Clinical contact says a very much similar story. You know, you don't have even like, you don't have the firearm categories as really kind of being a lead out category, right? Being much more prominent in their mental health symptoms or in their clinical contact. And that it's just not strong evidence for the hypothesis that they are that different in their mental health. So this is 2004. Again, we can then look to 2016. Again, we see one statistically significant result, and that's the light blue to gray. So other violence to other firearm violence. Yeah. And so this really kind of leads to several takeaways, which is, you know, even if there are some evidence for differences between violent and non-violent offenses, and we don't show too exhaustively here because we want to focus on firearms, there doesn't really seem to be much evidence that firearm is particularly associated with mental health above and beyond maybe the violent relationship. And so this really gets at kind of what Ethan was talking about beforehand, which is, you know, if we see that there's a relationship with firearm violence, we need to make sure we take out just that generic violent relationship first. But we also have to consider data limitations in this, right? We are using a cross-sectional sample. We tried limiting to people under 2 years, kind of invoke some sample size problems in some areas. And we also have to consider that it's a survey of stock and not admissions, right? And so there is probably some influence of incarceration. There are some studies that provide some evidence for this idea that while incarcerated, mental health may improve in some instances. But, you know, the literature is relatively mixed on that point. So temporal ordering is big. But we also have to think about population representativeness, right? So no person's judged to be mentally incompetent or not guilty by reason of insanity are included in this, right? They're not incarcerated. Or those just in general, right, in terms of ethics and being mentally capable to actually complete the survey. And so these are things that we're constantly thinking about in terms of to what extent do these results generalize to that main research question that we had, to that policy question as well. And like Ethan said too, we have several ongoing projects. The paper on the mental health of incarcerated transgender and cisgender individuals. But then we're also looking at other kind of qualitative characteristics of violence. So multiple victims. Is mental health associated with kind of these extraordinary or relatively unique forms of violence, right? Violence towards family members, parents, children, you know, those sorts of things. But these are all things that were possible because of this project and things that we were kind of working through. And we also kind of have future projects that we're more than happy to talk about. You know, is mental health changing behavior in the situation, or is it changing opportunity structures? And are those differences what's contributing to the null results here, right? Are they offsetting each other? But then also, how much of it is or how much of it is it due to the person with the mental illness themselves, or is it how other people are responding to them, right? And so this kind of gets at some work Ethan and I, and with Mark Berg and Dr. Richard Felsen at Penn State have done with disputatiousness. So these are all kind of ongoing projects. But anyway, thank you so much. Thank you so much for this opportunity. Yeah. Stop here.
So we can take any questions that any of you may have.
Nice work, gentlemen. Ethan, what do you see as some next steps?
I think Andrew hit on most of them that we want to focus on. So we are fortunate enough to present on this project as well at the American Society of Criminology Conference in November. So we're going to get some more feedback on that. I think thinking through in terms of also where we want to take this in terms of this was largely the descriptive piece. We also want to take it and consider some multivariate aspects. One thing that was been interesting that we didn't talk about too much in detail in this presentation is thinking about predicting lethality, or predicting whether or not it was a lethal incident versus a non-lethal violent incident. And we have some preliminary results that when we control for both whether or not a gun was there and the individual's mental health, we tend to find that the evidence strongly points to the presence of the gun is a far stronger predictor of lethality than mental health. So we're thinking about taking it a multivariate step as well.
Okay, that makes good sense.
Sorry.
I will just add that I think this is a great example of what we're trying to accomplish with these summer scholar opportunities, and getting people together to be able to do something and push an idea that you probably had before a little bit further than you might have otherwise, and just that little bit of a nudge to be able to do some really good research and scholarship. And thank you for following through and completing that.
Well, thank you again for the opportunity.
Thank you.
Yeah, absolutely. If there are no other questions, we'll let you. Oh, John has one. Go ahead, John.
Yeah, thank you so much. And I'm sorry I joined the conversation late. I noted that at least some of your research was conducted in 2016. And I wonder if you think that occurring at the sort of pre-dawn of the Trump presidency affects your findings, and how you might revisit that in subsequent research efforts.
Andrew, do you have thoughts on that in terms of, I don't know if this specific data set, do you know if they're doing another year?
I don't know if they're doing another year. Even the 2016 one, for example, came after a pretty long delay. You know, it's really 2004 was the last one, 2016 was the next one. I would imagine too that, like, if you were to study it like in the new kind of period, it's a great question, right? I think it depends, and it goes back to like Ethan's conversation about the types of mental health that we're studying. And so I think maybe you would see some stability in terms of some forms of mental illness and like violence, and specifically gun violence. But in terms of, I don't know, like oppositional related things, maybe you'd see more. But Ethan, maybe.
Yeah, I'll just add, I think that there's also some big questions in terms of the change in administration and so forth, in terms of what access might look like. So we talked briefly in the front end, John, about how various policies are being proposed, and some oppose these policies, but focusing on restrictions for individuals with mental illness. And so thinking about, as those proposals come in, how that might change this question. And Andrew noted it. I mean, the big question is it about access or use? And so far, the data, we haven't really been able to pull that apart.
Yeah.
Thank you.
And I would almost even say too, kind of as another component to this kind of conversation is, these policy discussions on mental health, right? You have to think about it. If we were to remove all policies that prevent access to guns, you'd probably see an increase for mental health and guns. But one of the things that's interesting here, we don't see many differences, but we don't know to what extent are the current policies responsible for not seeing differences in mental health and firearm access and things like that. So I think it's an interesting question, kind of getting back to what Ethan was saying of, we have to just see how access changes as it relates to mental health.
I have a question. This is Carrie. And you talked a little bit about it, and I'm kind of fascinated by the idea of gender and how gender plays in to sort of everything you were talking about. And I was wondering if there are particular policy implications for that, or how we think about the idea of gender in this area.
So this is something that, and this is a good example of how one project starts to inform the other and back and forth. This is something we haven't touched on in this yet, but I think it's certainly worth considering given our evidence in our other project highlighting the very, very big differences in mental health prevalence across men, women, and transgender individuals, how that might also inform, perhaps even looking at this analysis by that divide. So thinking about it among only men and among only women, but it's something we haven't quite explored in this project yet.
Yeah, I'm thinking too, like in terms of that, kind of going back to one of the future directions of like that disputatiousness, right? Like how does gender affect whether like mental health, gender, and the perpetration or victimization? I think that'd be interesting, right? It's just kind of seeing how all those factors kind of.
I mean, one of the things that you kind of opened with was talking about mass shooting events, and I can't even tell you how many times I've thought about this question of like, it's always men, isn't it? I mean, like, and is there something to that? And is there something from a policy standpoint that needs to, and I don't know what it is. It's just one of those observations that you can't help but make and think about, what does this mean for the policy?
It's super interesting because I'm sure you guys have all seen this, but like a period of like 3 weeks ago, like every news article was about how the gender divide in college admissions is changing and trying to explain why more women, or a greater proportion of women now, are enrolling and graduating from college than men. And so that's kind of what your conversation made me think of, which is, are there different like societal level pressures that are kind of leading to that will exacerbate mental health problems and the firearm, right?
Any other questions for Ethan and Andrew? All right. Well, otherwise, thank you very much for your presentation and your continuing research. That's about as policy relevant as it gets these days. So thank you.
Thank you so much.
Thank you all.